Hello, ladies and gentlemen. I'm Dinesh Dalbir. I would like to talk in brief about the proper use of hand sanitizer and hand washing techniques in order to prevent the novel coronavirus or the SARS coronavirus 2, which causes the COVID-19 disease. And there's a pandemic going on, as you all know. Many people, quite a significant amount of people, don't know how to use hand sanitizers properly. And if you don't use the proper technique, that won't make much sense and that won't help you much. So, first thing I want to tell you that hand sanitizer cannot replace hand washing. Okay, the best thing in order to prevent coronavirus disease is hand washing, the best mode of prevention. Hand washing with liquid soap, bar soap, foam soap, anything. Soap and warm water, that's the best thing. Now, if you don't have access to a restroom or a sink and you can't wash your hands, then you can use hand sanitizer, okay? But if you have access to a place where you can wash your hands, wash your hands. Don't use hand sanitizer. Hand sanitizer has limitations. Your hand cannot be too dirty or greasy, otherwise it won't work well. If there's a lot of grease in your hands and dirt, the sanitizer cannot reach the virus, okay? The grease can form aerosol around the virus. So the hand should be, overall clean. Cannot be too much greasy or dirty. The other thing is many people buy hand sanitizers without looking at the alcohol percentage. For the sanitizer to be effective, the alcohol content should be more than 60%. Less than 60%, it's no good, okay? So it should be more than 60%. And so when you use hand sanitizer, there's a proper technique. People say that the World Health Organization has also released this statement that you can sing happy birthday to you twice. You should rub your hands for at least 20 seconds so that you sanitize it properly. So no need to sing songs, okay? The proper way to use it, like, don't use small amount. When you are using the hand sanitizer and in the middle of the process, if your hand is dry already, that means you didn't put enough sanitizer, okay? Your hand should not be dry. In the end, it still should be wet and you should leave it to dry for a minute or so. So take enough sanitizer, okay? Now you took hand sanitizer here. This is how you start. Palm, you rubbed here, then go back to the back of your hand, to the dorsum, okay? With interlaced fingers on the left hand. And then you change hands. Go to the left between the fingers, laced, then come back here. Palms, okay? Move these palms like this with interlaced fingers, like this, interlocked, okay? And then you come back and start rotational movement, cleaning of the thumb, left thumb with your right hand, and then switch to the right thumb with rotational, okay? And then this movement forward and backward against the palm. And then this movement, okay? Back of your fingers against your left palm and then switch like this, left palm. You can do this. You can change the order a little bit, but these are things you need to do. And then you rub your palm like this and make sure they're dried out, okay? Don't wash your hands. See, it's still wet. So that means you use adequate amount of sanitizer. If it is dry in the middle of the process, that means you didn't use. So keep it for a while, let it dry, okay? Now, hand washing techniques. So let's say you have access to the restroom or a sink with soap. Don't use hand sanitizer. Wash your hands, especially when you eat. Before you eat and after you eat, always wash your hands. Try not to use sanitizer if possible. But if you don't have access to the sink, use the hand sanitizer, okay? Alcohol content should be more than 60%. So now, how do you wash your hands proper? It's simple, but you don't have to sing songs, okay? It will be more than 20 seconds. You turn your water on, use warm water, okay? Warm water. Use any kind of liquid soap or bar soap or foam soap. Here is a foam soap. Good amount, okay? Same thing. Rub your palms like this, okay? And then go here on your dorsum of your left hand, interlaced fingers. And then go above the right hand like this, okay? And then come back, two palms with interlocked fingers. Then go like this, back of your fingers against your left palm, and then switch back of your left hand fingers against your right palm, okay? And then rotational movement, cleaning of the left thumb, and then switch over, rotational movement, cleaning of the right thumb, and then bend your fingers like this, backward and forward movement in the end, switch over, okay? Like this. Now you have to wash, okay? When you're washing your hands, wash properly, thoroughly. And then take a paper towel, okay? Use your paper towel to turn the sink off. Throw the paper towel and then grab some paper towels to wipe your hands. When you wipe your hands, make sure you go like this, okay? Dry up your hands with this towel, paper towel. But let's say you somehow accidentally move to this side. And then you realize there's still some water between the fingers. You cannot go back. You have to throw away this towel. Get a new towel, okay? Once you get to this zone, you cannot go back because you haven't washed your forearm. So go back, take a new towel, wipe everything, and then you are done. Now if you are inside the restroom, you want to open your door, use this paper towel to open the restroom door, and go out, throw it into the trash, and you're done. That's the proper technique, okay? Thank you. Be vigilant, stay healthy.